My complete name is Muhammad Naeem. So I was born in Miawali. This is a district in Punjab, Pakistan. So my basic or primary education was there in my hometown. After that, I got my intermediate certification from Government College Bakar, and then I got admission in Ishtar Medical College, Multan. It was year 1998. So after graduation, I had the opportunity to do house job there in Ishtar Hospital, Multan. Like I completed 1 year house job in medicine and surgery. At that time, actually, I was planning for ophthalmology, but I was not sure. But one of my relative, he was ophthalmologist, and I met him. I saw his setup, and I was amazed to see the response of the patient. Like one patient comes to you with poor vision, low vision, and then you do surgery for that patient, and next day patient is seen very well, and his life changes. So all this in my back in the mind, I thought that I should go in this specialty because I thought that I can serve better in this specialty. Then I applied for FCPS Part 1 in ophthalmology, and I passed my FCPS ophthalmology Part 1 in 2005. It was end of the year 2005. And I started my training in ophthalmology. It was exactly in November 2005, and I completed in like November 2009. And I appeared for the exam, and I passed the exam in early 2011. Okay, and in the meantime, when I completed my residency, I was not having any regular job. So at that time, there was an opportunity to go to Saudi Arabia because Ministry of Health was coming again and again that year. It was 2010, and I had passed my written exam, but still my clinical exam was pending for FCPS Part 2 ophthalmology. So that time it was a very difficult situation for me regarding financial status and regarding my career. At that time, I was a bit confused that should I go to Saudi Arabia as ophthalmology resident because I was not having any qualification. That's why they were taking me as ophthalmology resident because I was having experience in ophthalmology. After that, I discussed with my senior colleagues. Most of them was advising me at that time, you shouldn't go to Saudi Arabia because still you are like in between, like in the mid stage. You have not passed FCPS exam. If you will go to Saudi Arabia, you will not have the opportunity to learn and practice your profession. So maybe you will be in difficult situation to pass the exam. But considering my financial situation and all other factors, and I did tawakkul to Allah. So I made a jump, and then I went to Saudi Arabia because at that time for me the financial independence and financial support was a bit priority at that time. I went to Saudi Arabia as ophthalmology resident. After that, when I reached there, they gave me the position of ophthalmology resident. But in Saudi Arabia, like in Pakistan, when you are working in some governmental hospitals, although you have been hired for some department, like for example ophthalmology, but sometimes if the administration wants someone to work in some other department, and you are as resident officer, resident medical officer, or you are like general medical officer, so then they can put you any other specialty or any other area of work. So being ophthalmology resident, I was you can say that appointed to work in ER, emergency room. So at that time I was what you call it, I was in difficult situation that what to do. Should I go back to Pakistan or should I continue something like this? But when you are in some other country and you have left your country for a while, then it becomes very difficult to come back. So I thought that I should continue for 1 year and let's go with the flow. So staying in Saudi Arabia was in that area, it was entirely different experience. Actually, working in Ministry of Health here is entirely different experience rather than working in some other hospital. But I kept on doing my efforts, and then I came from Saudi Arabia for my clinical exam in ophthalmology for Part 2, and luckily I passed. And then I was having FCPS ophthalmology qualification with me, and I talked to them and I told them I want to be specialist because before my position was as a resident, and it was a difficult scenario for me to work in ER rather than working in ophthalmology at that time. But the good thing at that time was that the ophthalmology department, it was another hospital away from my working place. So when I was free, I was going to them, and I was attending the clinic of 2 or 3 consultants there. 2 were Pakistani consultant, one was Indian, and one was, I think, Arab. I attended clinics with them, and I had the practice for short cases, long cases with them. And they were quite generous for this, teaching me, guiding me, and supporting me, and I was so thankful to them. It's another aspect of this journey, but generally, so they helped me and I passed. So I talked to the administration that I should be promoted as a specialist. But at that time, they were saying that if you are working as a resident, now you have qualification, so you need 2 years. So when you will complete 2 years as a resident here, even after doing FCPS, then we will promote you as specialist. Possibility is there, but they did not assure me. So my colleagues there and my other friends there, they advised me to go back to Pakistan. Okay, better. And then if you are still interested to come back to Saudi Arabia, so you can come back as specialist directly. No need to wait for 2 years post FCPS there. So I got the idea, and then I came back to Pakistan, and then I joined here in Lahore in Allama Iqbal Medical College, Jinnah Hospital, as a senior registrar in ophthalmology. So I worked there for a few months, and then I lost the opportunity to work there, and then I worked in some trust hospital, Mughalai Hospital, for a few months, and I was working in private sector, American Eye Center. So from 2011 up till 2012, end of 2012, I was working in different positions actually. There was actually like a different experience of my life, and I did hard work at that time at different places in different scenarios, and I worked a lot and I learned a lot actually. And I consider that post FCPS 2 years or 3 years, it's a very like a different part of our life. You are working hard, you are learning a lot, and you are like a new consultant, and you are ambitious also, and you explore many things. And also, I was working on to apply for FRCS ophthalmology. So if you have FCPS ophthalmology, then part 1 for FRCS Glasgow, it is exempted. And I then appeared directly in part 2 ophthalmology in Islamabad, and it was in 2011, I think, end of 2011, when I came back from Saudi Arabia. And then, frankly speaking, after that, I was not having so much financial resources, and since I was busy doing different jobs, so I was not having enough time to prepare for FRCS Part 2. So I got the opportunity to appear for FRCS Part 2 Glasgow in 2014. And that Part 3 or final exam, I appeared in Amman, Jordan, and I passed in first attempt, luckily. And in 2013, I got admission in fellowship in Vitry Retina in King Edward Medical University. And it started in January 2013, and the 2-year session, it ended in 2014, end of 2014, like December 2014, complete 2 years training. It was actually hands-on practice training with theory, and it was a good experience. And in the meantime, I was having opportunity to work as consultant ophthalmologist in some governmental hospital in Port Khaja Sikh Teaching Hospital. It was affiliated with King Edward Medical University. So it was easy for me to work some days there and to attend my training program also. So again, it was a bit difficult time, hard time, going in the morning some other space, other place, and in the evening some other place. So, but Alhamdulillah, it gives me opportunity to learn a lot and have different experience. And also in the meantime, I went for 3 months fellowship, ICO fellowship, International Council of Ophthalmology fellowship in Japan. So it was 3 months, like in 2014, I went to Gunma Prefecture. It was Gunma University Hospital. I worked with Professor Shuji Kishi for 3 months, and it was a wonderful experience of my life. My host professor, he was very kind and very nice person. Overall, Japanese, they are very nice people. Although in history they have something odd things, but currently they are very nice and very gentle people, very nature-loving people. They respect you a lot. And in 3 months, I learned a lot, many new things which I have not seen in Pakistan. Different concepts about dealing with retina patients and many other things like. So in 2015, I got the opportunity. In 2015, I passed my fellowship in Vitry Retina from King Edward Medical University. And in 2015, I got the opportunity to come again Saudi Arabia for 3 months locum consultant program. I went to Al Baha area for 3 months program. It was very good opportunity. Like I came here for 3 months, and I was having a very good or handsome salary at that time for 3 months. And all the program was arranged by CPSP, and I really appreciate the efforts of CPSP introducing this type of program. And it was a wonderful experience. I worked here for 3 months, and it was a good experience, by the way, there. A bit challenging. It was also Ministry of Health Hospital, but it was a good experience. Then in 2016, I got the opportunity to come here in Riyadh as consultant ophthalmologist. And at that time, I had completed almost 5 years post FCPS because I passed FCPS in 2001 and I came here in 2016. So the requirement at that time, my recruitment agent told me that you are almost 5 years post FCPS, so maybe they will give you license of senior registrar and maybe they give you license of consultant, but already the hospital has selected you as consultant. So this was the scenario. So Alhamdulillah, I came here in 2016. It was Feb 2016. So now almost more than 8 years, I'm working here in the same hospital as consultant ophthalmologist. And my previous experience is definitely anterior segment surgery. Most of us, when we are working in Pakistan, we are doing. But I was having fellowship in vitreoretina. But as up till now, I have talked to my administration many times, but still they're reluctant to start vitreoretina surgical services. Medical retina, definitely we have lasers, we have multiple type of intravitreal injections and all this. And regarding the surgical retina, still we are lacking this facility to provide our patients. And generally things are going fine, and I'm here for last 8 years. So this was my life journey. If anything else you want to know, I'm here to tell you. Thank you so much.
Thank you, sir, for introducing your life journey. Sir, there are many aspects of your struggle and efforts. Sir, I would like to ask you have successfully passed a VR fellowship in Pakistan, as I've heard so.
Yes.
So, sir, how was
Yes.
your experience in doing a VR fellowship in Pakistan? It will be done under the supervision of CPSP. And so, would you recommend VR fellowship or of that caliber of practicing, or you want to suggest any other specialty in particular aspect of
Okay.
Saudi Arabia or other GCC country?
Okay. So I started vitreoretina fellowship in 2013, and I was searching for this since 2012, like 1 year earlier, but I didn't get the opportunity to get this opportunity, this option. So my fellowship was under King Edward Medical University. So it was actually university fellowship. But our other colleagues, some of other colleagues, they were doing FCPS vitreoretina. This was under CPSP. So both are having 2 years program. And King Edward Medical University, they have different type of training program that every 6 months we were having some clinical meeting or assessments or appraisals. The technical word is appraisal. So 4 appraisals were there. We have to submit 2 research articles, and it was a little bit easy program than FCPS, because for FCPS vitreoretina, the other our colleagues who were doing there, they were having proper exam. Like after 2 years, they had to appear for written exam, and then they had to appear for like clinical exam. But for us, we were having 4 appraisals every 6 months, and there was exit exam in the end. And that was same like annual exam in any other university hospital. It was not like written exam and then clinical exam. It was actually viva exam with 4 examiners. And at that base, they decided us that we are eligible to be having a vitreoretina fellowship. And I was awarded degree by King Edward Medical University. So this vitreoretina specialty, actually, in my mind, after doing FCPS ophthalmology, I was having mind that I should do some fellowship, because I was thinking that the future, maybe 5 years, 10 years, will be the market, or you can say that the career will be like subspecialties in ophthalmology, considering this. So currently, if we are thinking about the current scenario in Pakistan, so currently we are having, I think so, pediatric ophthalmology fellowship and orbit oculoplastics fellowship and vitreoretina fellowship. These 3 fellowships I know FCPS is, CPSP is offering. And regarding the university programs, currently, as per King Edward Medical University, I don't know about the other universities, they are offering, I think, 2 fellowships. Maybe they were planning to start some glaucoma fellowship. So they are providing this one, fellowship in vitreoretina and fellowship in pediatric ophthalmology. But in universities, sometimes the curriculum is there, but the things are not so well followed up by CPSP. This, frankly speaking, I'm sharing with you. But if somebody is interested, so it depends on his own interest. Somebody, they are interested to work in VR. Somebody, they don't like VR. Somebody, they are interested to work in oculoplastics. They feel comfortable to work and do oculoplastic procedures. So I think it should be personal choice. And regarding the prospects of working, all the specialties, they have very good potential to grow. I have seen my friends who did pediatric ophthalmologists, they are doing very well, because pediatric ophthalmology has evolved a lot and it has progressed a lot, and even the patient awareness has increased. I'm doing here, I'm working here for a long time, and if I look back last few years, so for last 8 years I'm working here. So initially when I was here, I was doing squint surgery also, because during general ophthalmology training in Mayo Hospital, Lahore, I had the opportunity to do squint surgeries. I was doing DCR also, and I had the opportunity to do DCRs here, do squint surgeries here. But currently we have a pediatric ophthalmologist here. He's Saudi and he has 1 year fellowship from Canada. So he is the most busiest person in our ophthalmology clinics. We are almost 18 to 20 consultants who are doing clinics here. So the most busiest person is pediatric ophthalmologist. The reason is that now patients, they want to go to pediatric ophthalmologist if their kid is having some problem. Even only squint patients, they are like in a big number. So regarding this, and regarding vitreoretina, I have another colleague who is vitreoretina surgeon, and he is Saudi, so he has subspecialty license as consultant. For me, I have a license as from Saudi Commission for Specialties as consultant in general ophthalmology. I don't have a license in consultant in vitreoretinal ophthalmology. So this is another difference that Saudi, they can get the subspecialty license also, and for expert like me, still there are some difficulties and there are some technical issues. So I did not see any non-Saudi person with vitreoretinal ophthalmology or pediatric ophthalmology license. So this is another discussion. So my suggestion is it should be your own choice that which area of ophthalmology you like to work more. So otherwise, potential and regarding the career development and earning money is no issue, and demand for all specialties are there.
Sir, I've heard in Kingdom of Saudi Arabia there is a lot of potential and space for the orbit and oculoplasty. So, is it so, or is there a different ground situation in this regard?
Okay, so regarding orbit and oculoplastic surgery, there are many different things. Actually, there is demand in all the world. The cosmetic procedures and like in eyelid, and we are still, frankly speaking, I am also doing blepharoplasty in some cases on the demand of the patients. And I learned from some small courses I did, and then I learned blepharoplasty, and I'm doing blepharoplasty also on demand of the patients. But we have an orbit oculoplastic surgeon here. He's also Saudi, and he has very less number of patients, by the way, because many of his patients are distributed. Two or three other our general ophthalmology consultants, they are doing eyelid procedures. So we cannot say that it is too much in demand. There is demand, but not too much. Once I got a message from one of my colleagues. He is working in Makkah, and he was saying me that they need one person who has experience in orbit oculoplasty, and he can work as oculoplastic surgeon. They did not ask for any specified or any earned fellowship in orbit oculoplasty. So there is need, but not too much.
So, sir, what, for example, if any doctor ophthalmologist wanted to pursue his future in GCC country, so in terms of earning and which subspecialty you think is more appropriate? Although there is, as you have told, there's a space for personal interest of the person. Obviously, the interest follows the patient. But particularly speaking, in practical world, what subspecialty you think is more appropriate, or one should think in there's a which will help him in choosing those.
Actually, we have to talk about the need.
Yes, yes, exactly.
Yes. So which specialty is needed more? Actually, all the specialties are needed here. They don't have too much oculoplastic surgeon. They don't have too much vitreoretinal surgeons. But I have seen that many Saudi people now, they are doing vitreoretina fellowships, training from outside, and I'm sharing you the reality in Riyadh. This is I think, the biggest city in Saudi Arabia. So we have a lot of private hospitals. We have a lot of big governmental hospital, and still in very few centers, vitreoretina surgery is being done. One reason is maybe people, they are still reluctant to go to this specialty, considering the poor visual outcome, and then there's a lot of post surgery issues with the patients. You have to follow up a lot and something like this. So the easy way of earning money, people, they think that if they do for anterior segment and refractive surgery fellowship, there is a King Khalid Eye Hospital, specialized hospital, and people, they are doing specialties here: anterior segment and refractive surgery. This is some separate fellowship for them. They have glaucoma separate fellowships. They have vitreoretina fellowship programs, something, and pediatric ophthalmology fellowship program. So they have the programs, but mostly people, they are interested to go for anterior segment and refractive surgery. And in near future, and the interesting thing is, this is the most needed thing in our field of ophthalmology. For example, daily someone is seeing 30 patients, 40 patients, one general ophthalmologist is seeing. I think most of the patients, they are in this specialty, like anterior segment and refractive surgery. So the most needed specialty is anterior segment and refractive surgery. Okay, and then second number, you can say that vitreoretina surgery, and then comes the other glaucoma and orbit oculoplastic surgery. Okay, but considering the opportunities wise, so definitely the more opportunities are still for anterior segment and refractive surgery.
Okay, sir, you have experience of working in Pakistan in both government sector, public sector, and private sector, and also in GCC country like Saudi Arabia and Japan as well. You have did the fellowship, sir. So comparing all these paradigm, which, for example, for the new ophthalmologist consultant who just passed the FCPS, which thing you recommend? Going to GCC country or practicing in the Pakistan in the public sector or the private sector, or pursuing any post fellowship in any Pakistan institution or any foreign institution like UK, US, Canada, or like this?
Yes, there are different options, and actually, all the decisions sometimes depends on your own financial circumstances, your family circumstances. Then you decide that which option is better for you. After SCPS, I usually recommend our other colleagues that you must do 2 years job in some area where you can earn a lot and you can increase your experience, you can improve your surgical skills, you can improve your clinical skills, and that will pay you through your whole life. When I was in Saudi Arabia, one of my colleague, after passing my FCP exam, he told me better you should go back to Pakistan rather than staying here for 2 years. Go to Pakistan and work there for 2 years. If you are working in some big hospital, like some, it can be some governmental hospital, it can be some big trust hospitals like LRPT, or we have in Lahore Mughalai Hospital. They have variety of work there. So you should do a job which will demand hard work, and then you will improve your skills. So these 2 years are very important post fellowship. After that 2 years, you can move around anywhere. You can go for GCC countries. You can go for some other countries like some people, some of my colleagues after FCPS, they did FRCS, and in the meantime, they are working somewhere, and they passed their FRCS Glasgow, they did IELTS, and then they moved to UK. They got the job of specialty doctor, and one of our friend, he did FRC off there, and now he is in the line to become the consultant. And one of our colleague, he did FCPS, and then he completed his FRCS, and then he was having the opportunity to do 2 years fellowship in cornea. So I will suggest like this. So it depends on your own circumstances. Everybody has different circumstances. Nobody can have the same pathway which I'm telling, but opportunities are there. And the last thing I will talk about staying in Pakistan. If somebody cannot move from Pakistan, so he can stay in Pakistan, but at least he should do 2 years work in some big hospital post FCPS to polish his clinical and surgical skills. And then after 2 years, rather than going to some job, he should start some private setup. And regarding the private setup, as you know, in big cities, there's a lot of saturation. He can go a little bit away from the big cities. In small cities, there's a very, very big potential. And I have seen my friends who are having who are having a lot of patients and a lot of surgeries, and they have improved a lot. So there are options. So everybody has his own choice and his own circumstances, and he can decide depending on his situation. But definitely, everybody from his heart, he think that he should stay in his home country. But sometimes circumstances are there. And the other thing I want to share with you, that when I was coming to Saudi Arabia, I was thinking that maybe I will stay here for 1 year, 2 years. I will earn enough money, and then I will go back to Pakistan, and I will start my own setup. But when I worked here for 2 years, then I was seeing back to my country. At that time, financial situation was going a little bit hard. So that's why I prefer to stay here. So different people, they have different thinking, but with the time, the decisions change also. But definitely, I always think that we should keep on working to improve our value. How we improve our value by increasing your academic qualification, by improving your skills. So this journey should keep on going.
Okay, sir. So, for example, if anybody has done the FCPS and wanted to pursue his career in a GCC country, so which GCC country, and in your experience, is best to go and to work and to earn good earning?
Okay, so I'm working here in Saudi Arabia. So I have come here for 3 times, different times. First, I came in 2010. It was for 1 year. Then I came in 2015 for 3 months, and now I came here in 2016, and now it's 2014. So 24, sorry, 2024. So I have different types of experiences, and I have friends who are working in Dubai, in UAE. I have friends who worked in Kuwait. I have friends who are working in Qatar, but I have friends in Bahrain, few friends in Oman also. So these are the mainly GCC countries where Pakistanis go. So the biggest country in GCC is Saudi Arabia. The biggest market is Saudi Arabia. So I consider usually that coming to Saudi Arabia is having more advantages than in any other GCC country. But everybody has his own different experiences. One of my friend, he was consultant in UK, and he came here in Saudi Arabia, National Guard Hospital. I asked him that you have a lot of qualifications and you are able to go there in UAE also, Dubai, and why you came here to Saudi Arabia? He said actually everybody has different type of lifestyle or thinking. So he told me that he's more kind of religious person. So, and he was thinking that if he will stay in Saudi Arabia, his lifestyle will be as per his own tendencies are, you can say like this, okay. But if he was thinking that he will go to Dubai, so there the environment and working environment is a little bit different, although it is kind of international standard. Dubai is a very good place, but for him he was thinking that he felt that he will be uncomfortable there, rather than he was thinking that maybe he was able to get more better money there. And also when somebody is coming to Saudi Arabia, he's thinking that he has advantage of access to Makkah and Medina. Even he's working in Riyadh, so you're working in Dammam, any city. At least you don't have to get visa or any other issue, so you can go directly to Makkah and Medina to perform Umrah and for ziyarah of Masjid Nabi Sallallahu Alaihi Wasallam. So this is one aspect. And my other experience regarding the job is that I work here as ophthalmology resident, then kind of specialist when I came on locum, specialist come consultant, and now working as full-time consultant. So up till now, my experience in Saudi Arabia is good. My other friend who is working, and the entry path was easy for me because I was just interviewed and I got the opportunity to work in Saudi Arabia. I came here and then I appeared for the exam. My paperwork, everything was done by a recruitment agent, like data flow, everything was done when I came here. And I didn't appear for exam while I was in Pakistan. Although now the current situation is different. Even at that time, in 2015-16, for Dubai, there was a requirement for the exam. You have to pass HAD or you have to pass their MH exam or for Dubai Health Authority exam, and then you were able to get the job. But in Saudi Arabia, the situation is a little bit different and more easy paths to come here. And maybe you have seen that most of the time, Ministry of Health teams, they go to Saudi Arabia and directly hire you. You don't have to pass through any big exam or anything. They just interview you, they assess your clinical knowledge and all this, and then they decide, okay, you will come with us as consultant, you will come with us as specialist, something like this. So this was the one thing that why I came to Saudi Arabia, because it was a bit easy for me. And Dubai at that time I was planning for exam, but I was not having time, and it seemed to be a lengthy process. And if somebody is FCPS, he cannot be consultant there in Dubai, even in Qatar. But in Saudi Arabia, I got my consultant license on the base of FCPS, not on the base of FRCS. Because as per Saudi Commission for Health Specialties, FCPS with 5 years experience is eligible. Yes. So I was telling you that after post CPA of FCPS, if you have 5 years experience, you are eligible to become consultant ophthalmologist here in Saudi Arabia. But this situation is not valid in Dubai, in Qatar, in I don't know about the Oman actually. But in Saudi Arabia, for sure, if you have FCPS and 5 years experience, you can become as consultant. And I am example in front of you. I have many other friends who have become consultant after FCPS. Okay, although I was having FRCS. So if you are FCPS and want to work as consultant, so then Saudi Arabia is the number one option. If you will go to Dubai, then definitely they will ask you if you have FRCS and FRCS with training in UK. Then they consider them as consultant. If you have FRCS, like you did FRCS Glasgow, just you passed the exam, then I think you are not eligible to become consultant there. So there is a little bit difference of certification or accreditation there. And so regarding the Saudi Arabia, I told you that it was easy path for me, and I was offered the position of consultant, so I came here. And up till now, alhamdulillah, things are going fine. Why you come as consultant? Because here in Saudi Arabia or Gulf countries, if you are consultant, if you are specialist, if you are senior specialist, or if you are resident, so there is clinical privileges. Not like in Pakistan. In Pakistan, if you are past FCPS, even you don't have another some certification or anything else, you can work as consultant. There is no in between specialist. Okay, so maybe some diploma holders, they can come as specialist. So, but here in Saudi Arabia, every accreditation or the level of classification, they have their own clinical and surgical privileges. So if you will come as consultant, you will be in more better position. You will be growing better. you will be earning a big amount of money as compared to the specialist or resident. So I will suggest that better to plan and come as consultant in Saudi Arabia or any other countries.
Uh,
Regarding the Dubai, as I have told you that FCPS is not eligible to become consultant. You can work as up to senior specialist. One of my colleagues, he is working there as senior specialist in some private hospital in Dubai. It was Zulaifa Hospital. He worked there for a few years. And in private hospital, there are some compromises sometimes on the classification or something like this. But generally speaking, if you have proper required qualification, then it will be good. Regarding the Oman, mostly I think so that I think there is less Pakistani ophthalmologists there as compared to Saudi Arabia. And actually, I don't have too much idea. I have few friends. One is an ophthalmologist, and he was praising a lot. He was saying very good working environment, attitude of people is much better. It's better than Saudi Arabia and all this. And regarding the Qatar, one of my friend, he is pediatrician and working in Qatar, and he came from UK actually. He has all the training from UK, so he is working as consultant pediatrician there and having a very good experience. So if I compare all, like I compare with Dubai, I compare with Oman, I compare with Qatar, I compare with Bahrain. Bahrain is rather a better opportunity. If somebody has FCPS and he wants to work as consultant, then the first option is Saudi Arabia, then second option is Bahrain. But in Bahrain, it's a very small country, so less job opportunities there. I know few ophthalmologists there; they are earning a good money, and the salary is almost comparable with Saudi Arabia. And one of my friend, he came to Kuwait like 2 years ago, and he was FCPS, and they took him as a senior registrar. It is like equivalent to specialist here in Saudi Arabia, and the salary, as per my expectation, was less. But generally speaking, my friends there in Kuwait, they say that your salaries are, if you're working as consultant, is comparable almost. A very minimum difference. Okay. And regarding the Dubai, my friend who was working there as senior specialist, his salary was less as compared to my salary, and that's it. He was unable to work as consultant because he was FCPS ophthalmology, although he was having FRCS Glasgow. But there the requirement is that if you have FRCS, it should be with training from UK. So this was overall comparison of different countries regarding getting the job opportunity.
so,
And I have more experience in Saudi Arabia, and if I compare with Arab people, so I feel that Saudi Arabia is a big market and it is better place to work. And there's another issue: what is the lifestyle in different GCC states? So this we can discuss.
yes, exactly. My next question was about the lifestyle, especially in regard with the living with the family, and especially the schooling and education of the kids, and also with the for the doctors having the aged parents. So, what about living with them in the Saudi Arabia and other GCC country? How you see all of these issues?
Okay, first of all, I will talk about definitely Saudi Arabia, what I am experiencing here. So the concept of Saudi Arabia was that it is a very hardcore and too much conservative and traditional, and some, you can say that, hard on belief kind of country. But currently, what I see Saudi Arabia when I came in 2010, and now currently in 2024, when I compare Saudi Arabia, it has changed a lot. 180-degree change, you can say that. Okay, so there was a lot of restrictions, lot of problems, but currently Saudi Arabia is much better to live, considering the openness, considering the restrictions and all this. So what I think that maybe in next few years, uh, I'm not talking about maybe the peripheral areas or the small cities of Saudi Arabia. If I consider the big cities, so it will not be less than Dubai, or it will not be like behind any other countries. They have digitalized their countries. And regarding the family, so the main concern is that living expenses. So few years ago, it was not so much expensive. Now Saudi is also getting expensive. Like for example, if one family of husband wife with two kids, like routine living expenses were like 2,000, 3,000, something like this. Their grocery, all this. But now I think it has increased 3 or 4 times. And regarding the kids, the education is another very expensive thing. Like one of my colleague, his son, they are studying in Pakistani school. On average, he was telling me that for one kid, the expense for school is almost 17 to 18,000 Saudi riyal per year. But if you are going for some other international school, so it will be from 25 to 30,000. But if you are going to a good standard school like American school or British school, big school, so it can reach up to 60,000 or 70,000 per year. So you can calculate that per month how much expensive it is. And if you are working in some governmental hospital, most of the time they are providing you accommodation. But if you have to get your own accommodation, then definitely before it was cheaper, too much cheaper. Now the rent has increased a lot. So regarding the residential point of view, it has become expensive. So now the saving money is a bit difficult here. But if you have very good salary, if you come as consultant, then definitely you can save a good money, and you can plan as per your the need that you have to invest the money or save the money somewhere. And in Saudi Arabia now we have got the opportunity, if you are a consultant and your salary is up till some limit, so you can apply for premium residency. It is same like golden visa in Dubai. So it is premium residency plan for 5 years. And Saudi Arabia started giving residency to some other professionals also, and with some extraordinary innovations or experience or specialties. But premium residency is a good option. And Saudi Arabia, the health system is entirely going to change. Like currently, Ministry of Health is providing 70% health services. Then comes National Guard hospitals and military hospitals, and then comes the Ministry of Higher Education hospitals, and then comes Armed Forces Hospital, and then comes private hospitals. So now the future is for the private hospitals. So big medical cities in private sector, they are developing. And I think there will be a big opportunity for Pakistanis to come here and work here, because working in private hospital, if you have the skill, both clinical and surgical, you can excel, you can earn good money. So I see a good future or a good number of jobs in Saudi Arabia as per my current view. And regarding living in other countries, my friend, I can just quote his experience. So he's earning around 50,000, let's say, dirham, and he has to pay by his pocket. So for the residence, so residence is very expensive, much expensive than Saudi Arabia, and also kids' education is very expensive. I think on average, definitely saving money is less in Dubai or some other states than in Saudi Arabia still. So so you will say that I'm talking more positive about Saudi Arabia. But if I compare, I see the difference.
Yes, sir, exactly. Sir, what about living with the parents? For example, if somebody has the old parents, so or they have to pay some fees if they are keeping them in Saudi Arabia, or like wife, kids. I've heard so they have to pay a certain amount on upon them.
Okay. So there was actually dependent DEVI or dependent tax, you can say that, for people who are working in private sector. If you're working in some governmental hospital or some government agency, so then you don't have to pay that dependent fees. So that dependent fees is actually 400 real per month per person. So if you are a family of 5 people, you are the working person, then the other four you have to pay. So it will be like 1600 per month. So at the end of the year, you have to pay that money, otherwise your ikama will not be renewed. And regarding the parents, you cannot get ikama for the parents as per routine. But nowadays, Saudi Arabia is issuing 1 year multiple exit re-entry visa for your parents or your brother and some sisters and kind of this, like family relatives. That is called family visa. So some of our colleagues, they have arranged that family visa, and then their parents, they are living with them, and they can come and go back to Pakistan very frequently. And there is another scenario, for example, if somebody has parents, like father has died, God forbid, so, and mother is alone, and he wants to keep his mother with him. So there is opportunity or option that he has to present the certificate of his father, and then his mother's ikama can be processed, and she can stay as dependent like his kids and other family members.
Okay, so you have told us about the kids' education and all this. You have mentioned about the two system of medical services in Saudi Arabia. One is government setup and other is the private setup. Sir. So, for example, if anybody is coming after 5 years to pursue the future at practice in Saudi Arabia, so how he can approach government setup or private setup? What is the process and where he can approach and how to do these things?
Okay, so regarding the government, there is a lot of different branches, you can say that. If I'm talking about the government, so the main stakeholder is the Ministry of Health. 60% health services are provided by Ministry of Health. Then I told you National Guard Health Affairs, Ministry of Defense Hospitals, Armed Forces Hospital, and higher education. It means that the university hospital. And there is another category, they are like medical cities. They are entirely different from Ministry of Health also. So all of them, they have their different way of hiring the doctors. Okay, let's say we talk about the Ministry of Health. Ministry of Health, maybe you have seen also that most of the time the delegations of Ministry of Health come to Pakistan through different agencies like Fauji Foundation, Qureshi International, Najm International, and maybe Overseas Employees Corporation, and there is some American International. There are different recruitment agents. They are mainly recruiting for or helping for Saudi Arabia. So at that time, you will be knowing the dates, and then you can go to that delegation for interview, and then you will be hired depending on your situation. Okay. The second option is National Guard Health Affairs. National Guard Health Affairs, they don't come to Pakistan, and you can contact through these agents, as I was mentioning, that American International, they were, I think, helping the hiring for this National Guard Health Affairs. And other option is you can go online and see their website, career portal. You can submit your CV, and you can be processed for hiring. I have experience of submitting my CV to National Guards like way back many years, 10, 15 years ago. So you will submit CV, and then they will give you response, and then you can keep following with them. The problem with National Guard is that they don't take FCPS as even specialist. They take FCPS as staff physician. And staff physician is the same like resident and in between specialist kind of thing. You're not allowed to do surgery or something like this. So if somebody has only FCPS, I think National Guard is not the best option for him. Okay. Okay. And another thing is definitely they have good salaries than any other health systems. And then comes the Ministry of Defense. So Ministry of Defense also, they do hiring by different recruitment agents. One I know was Mirza ji. He was recruiting for Ministry of Defense, I think American International, and this Najm International, they were hiring for Ministry of Defense Hospital. And then comes the Higher Education Commission. I just forget to share with you, I got the opportunity to come here as Assistant Professor of Ophthalmology. It was in 2015, but I didn't come actually. I got the opportunity through, there is a recruitment agent, his name was Medi Specialist. There was Mr. Shakil Mughal, he was from Karachi also, and he had history of working in CPSP also. So different institutions are different, you can say the departments, they have different way of hiring the people. And then comes cities like medical cities, King Fahd Medical City, King Faisal Specialist Hospitals. So they have independent bodies actually, and they hire by themselves, and they have their own recruitment agents. I don't know exactly, but if you don't have any opportunity or any other information about the recruitment agents, you can go directly to their website and you can submit your CV there. Like I have experience of submitting CV to King Fahd Medical City here in Riyadh, and I submitted CV in 2011, and then I was in Pakistan, and once I received a call from Fahd Medical City, and they told me that okay, we have reviewed your CV. It was in 2014, like after 3 years, and they told me that we have reviewed your CV and we want to hire you as assistant consultant in ophthalmology. So when you will be available for formal interview? So I said okay, so tomorrow. So next day, the head of ophthalmology, he called me, and we had like 10 to 15 minutes talk or interview like this online. And after 1 week, I got the job letter. And then actually, I was busy at that time doing my second fellowship in Vitri Ratna. So actually, I was not interested. Even they were willing. They were saying me, you have to come in 1 month or something like this. I said no, I'm busy for 1 year. I cannot come now. So this was one way that you can get the job offers. Then comes the private hospital. So the private hospital, they also have different type of recruitment agents, the different people they have. So like, for example, I came here in the law hospital, it's the healthcare system. So for them, the recruitment agent in Pakistan was Mirza ji. Mirza ji is based in Pakistan, but they are working for all the provinces. They have one office in Pindi, they have one office in Karachi also. We have many colleagues here from Al Khan, not in ophthalmology, but mainly in radiology and other specialties. So private hospital like Salman Habib, they have their own recruitment agents, and they are, I think, giving some advertisements in the local Pakistani newspapers. Another option can be that if you have reference, like some of your colleague, he or she is working here in some private hospital, so you can send CV to him or her, and then they can submit CV in HR, and then you can be processed and hired. This can be one opportunity for private hospitals. There are small agents also. They just hire for some small polyclinics or something like this. I don't have actually idea about them.
Okay, sir. So what is the hierarchy of practicing ophthalmology in Saudi Arabia? You have already told us, but I just wanted to have an idea about their hierarchy along with their expected salary. For example, from starting, if you start from a resident. senior resident like this. So what are the
So I have experience of working as resident, specialist, and consultant all. So regarding the because but entirely different and different type of private hospital. Private hospital you can compare same like in Pakistan. Very big hospital or good hospital, for example, like Aga Khan, they will give you different salary package. Shaukat Khanam, they will give you different salary package. If you're going to some small hospital, then definitely their salary package will be a little bit less, something like that. So generally, I will talk. So regarding the resident doctor, he has only qualification MBBS. He don't have any other experience, so he will be hired as general practitioner or resident. So he will be given salary depending on his MBBS degree and post MBBS experience. So roughly, I can say that it can be from 5,000 to 10,000. So if somebody has long experience, like he has done graduation maybe 15 years, to become specialist and fresh FCPS. And in some cases, MCPS with 3 years or 4 years experience can come as specialist also. Different specialties, needed specialties like OB-GYN. I have seen some people, MCPS with 3-4 years experience came as specialist. So they can start from 12 to 17, 18, up till 20,000. Okay. And another thing I just wanted to share, I just remember now when I came back from Saudi Arabia in 2011, and in 2012, I just appeared for interview for MOH team. At that time, I was just going as a fun. I went there and then I got the opportunity to come as specialist in Saudi Arabia. It was 2014. And then they told me, okay, you have FCPS degree and post FCPS, you have only 1 year experience or maybe 2 years at that time. So we can take you as specialist. I said, well, how much salary you will give me? He said it will be like 14,000, something like this. So MOH is the least salary they have. So it was just like this. So then after specialist comes senior registrar in Saudi Arabia. I'm talking about this one classification levels. So the senior registrar, they can have salary starting from 22,000 to 26, 28. Very, very rarely they can go up to 30, depending on the situation. And regarding the consultant, the salary in MOH, it is less, much difference with the private sector. One of my colleague, he came to MOH and his salary, excluding the housing rent, is 25,000 only. But in good private hospital, you start with 35,000. So this is a big difference. And if you come as consultant to armed forces hospital, military hospitals, Ministry of Defense hospital, they say it. They also start with 35 to 40,000 Saudi riyal for consultant. And then it depends on your experience, on your skills, your subspecialty experience, and all this. So a consultant can go beyond 50,000 also.
So you have mentioned about senior registrar and consultant. So what is the criteria for the consultant and what is the criteria for senior registrar?
So actually, this is a gray zone. You can say that this is not like specified. They say here that if you are fresh FCPS, you can come as consultant. Sorry, specialist. If you have FCPS with 3 years experience or 2 years experience, then you can come as senior registrar. If you have FCPS with 5 years experience, for sure you can come as consultant. One of my friend, he came in PDA and he was hired as registrar because he was fresh FCPS. And he appeared for Saudi Council. He submitted his papers, all this, and then this is actually online system, and they offered him classification of senior registrar, although he was just having experience of 1 year. But generally speaking, fresh FCPS is eligible to become to come as specialist. But if FCPS has experience 2 to 3 years, he can come as senior registrar, and if with 5 years experience, he can come as consultant. This is a little bit difference.
So, sir, means and what about the living expense in Saudi Arabia, for example, if we consider, although it can be different from for different cities, but on average, what will be the total living expense?
If I am talking about you're right that different cities have different rates. Like Riyadh is too much expensive. Jeddah is maybe too much expensive, but if you go to small cities, definitely they're much cheaper. Okay, first of all, you have to talk about the grocery items. So roughly it can be around 2,000, something like this, 2,000 to 3,000. The kids' education, if you have 2 kids, for example, and you are going for some international or mid-range international school, so at least 2 to 3,000 per month for one kid. And regarding the housing or residence, if it is provided by the hospital, it's okay. If it is not provided by the hospital, you have to arrange 2 or 3 bedroom apartment. So in Riyadh, the rates are too much high. Before, the rate was around 20,000 to 30,000 per year for 2 or 3 bedroom apartment, but now it has maybe reached 40,000, something like this. But in small cities, still you can get it in 20,000 riyal per year housing. Okay.
Okay, sir. Sir, you have told us about being a consultant in Kingdom of Saudi Arabia. Sir, what are the things which you, according to your experience, matters more in acquiring a good job and good salaries? I've also heard this salary are negotiated, means they can change from person to person, also depending upon few parameters like speaking Arabic, having FRCS. Is it like so? If yes, then what are those parameters which can earn us good salary and give us the good privileges?
You're right. It is negotiable salary. Although in Ministry of Health, if you're coming for Ministry of Health, they say that we have this is this, and but it is negotiable. As I was having one opportunity to be hired as consultant in Ministry of Health hospital, and they were hiring me salary. So they told me we will give you salary 27,500. I said them how you calculated my salary. They said me that you have a FRCS degree. We give FRCS degree 22,000 something. Okay. And I told them if it was FCPS, so he told me, okay, if we were calculating based on FCPS, so it was 8,000 for FCPS, and if you have FRCS, so we were calculating 22,000 something for you. And then post FRCS, we will consider your experience. So it was at that time maybe 6 months or 1 year maybe, and then they were giving me some allowances. That's why they were calculating 27,000. So definitely your degrees, they matter in calculation of the money in Ministry of Health, and also they can add up allowances. Then I told them 27,000 is very less. I have better opportunities. Then they told, okay, we will give you some, I don't know, they say it, expensive city allowance or some allowance. I don't know what was they naming. They said, okay, 4,000, we will give you this one. Okay. And all the calculation they made from here and there with allowances, they take up to 33,000 for me. They increased like this, and they were knowing that which allowances they can add up in my salary, in my basic salary, to give me the final or total salary better than my expectations. So definitely it is negotiable. And in private sector, it's a big you can say that a big chance to have negotiation. One of my colleagues, he came here in private sector. He was offered 17,000. He was coming as a registrar actually. Then he was saying, no, 17,000 not acceptable to me. And then he came on 23,000. So almost 5,000 were increased in his salary as per his negotiation. But depends on the situation that they need you badly, or if they have a lot of CVs, and if you will not agree with them on 17,000, for example, if they will have the other CV and he will be willing to come, so they will take that one. So regarding negotiation, you have to see the situation, and then accordingly you can decide. Like hot needed specialties, like for example, I will talk about neurology. You don't have many people who are neurologists, so you have the power or you have the opportunity to negotiate. And regarding ophthalmology, if we are talking, if somebody have a fellowship in anterior segment plus refractive surgery, and you think that they need you, that then you have the plane. You can negotiate with them also. So it depends on the situation, but definitely there are chances can be negotiated.
Sir, once you told about the FRCS and post FRCS experience, sir, what about other things which they can use to calculate the salary? Like I've also heard about knowing the Arabic language, just about speaking, and any other anything other things which are important in deciding that salary.
I have not noticed any difference based on this regarding the language.
Okay. So, sir, means if one has done the FCPS, then he should go for the FRCS because it will help him to in acquiring a good salary. Yes, sir. You may please continue.
I think we were talking about the salary structure and salary packages. So I have mentioned to you that a consultant on average, he can start from 35,000 Saudi Riyal to 50,000 Saudi Riyal, depending on his qualifications and experience. And it can be more than this. Like I know people who are working in private sector, they are earning a lot because some salary packages, they have basic salary plus share for their surgical and clinical work. Okay. Another important point which I want to talk, which most of our young ophthalmologists and colleagues, they think while they are planning to come to Saudi Arabia or any other Gulf countries, it is actually career growth. Most of the people, they think that when you come to Saudi Arabia or you come to Dubai or some other countries, your career growth is nothing. So you don't learn more. Actually, it depends on yourself. opportunities to grow in your career here in Saudi Arabia. Not same like Pakistan or in your home country, but like for example, I give you example. I came here as a consultant ophthalmologist, and I wanted to do blepharoplasty, and I wanted to grow my clinical skills also. There are opportunities, so you can get your leave, you can go for some short courses, and then you can start doing that procedure in your practice here. So being consultant, you have open clinical privileges. You can do any procedure which you have certification for that. So this is one aspect. Another thing is I have seen young colleagues who came after FCPS and joined here as assistant consultant or some other position here in Saudi Arabia. And then after that, living here, they were having good time, they were having good money, so they proceed for FRCS exam, and they proceed for like other training programs. So some of them they moved to UK from here, and I have seen some people who came here with ophthalmology diploma only and came on the job of resident ophthalmology, and then they proceed for FRCS. They got FRCS, and then they were promoted as specialist, senior registrar, like this. And all these opportunities are available. And I'm not saying that it is valid for all the doctors, but there are circumstances you can grow. Saying this that there is no growth, no, it is not true. I have seen some of my colleagues who go to some conferences. On every conferences, they go and learn some procedures with short courses. And some of our colleagues, they did some second fellowships, like short-term fellowships while staying here. Getting leave is sometimes difficult. Somebody has done like online programs or something like this. So there is a limited opportunity to grow your career both clinically and surgically. So this is not the end of life here regarding your career goals. Some of colleagues, I have seen them that since they have ample time, so they have written a lot of review articles, research article. So there are opportunities. And as I notice sometimes that here in Saudi Arabia, health system, it is actually still evolving. It's a new system. If we go back to the history of all the Gulf countries, they were not having a valid health system, same like in our countries, Pakistan, something like this. Their health system, even the Ministry of Health in Saudi Arabia, it was formed, I think, in 1960. And before that, there was no big hospital actually. All these medical cities and all these, I think this is story of last 40, 50 years. So they don't have long or more history of having this good medical services. All this is still under the process of development, and the systems are changing. Before, government was the one responsible, then government shifted many things to the insurance companies, and now even the government is planning to shift all this patients burden to the private sector through insurance companies. So still the health system is evolving here, and there are opportunities for jobs, and after the job you can have the opportunity for growth.
Sir, I want to ask about after having FCPS and 5 year experience post qualification, do we have to give some exam for to practice as a consultant or SR?
Okay, there are two options. Actually, if you are coming as a consultant, you have got job opportunity as a consultant. Even without job opportunities, you can proceed for this. So there are two options. Sometimes they are asking for exam, that is multiple choice questions, and sometimes they are only asking for the viva or clinical, like interview type of exam. But if you are having the eligibility of specialist or a senior star, then definitely you have to appear for exam. And for that exam, the centers are available in Pakistan. And usually, I think it is conducted by ProMetric. This is online kind of exam if you are still in Pakistan. Some of our colleagues, they processed all the papers, they got the eligibility letter, everything. They were having job offers. They came here. They already scheduled the date for exam. And when they reach here in Saudi Arabia, they came in like same time period when they were having like after 1 week or 2 weeks they were having the date for exam, and then they appeared for exam here for Viva here. But I know some of my friends or some of other colleagues, they appear for exam, online exam, while staying in Pakistan.
So, sir, we have to apply for this exam after getting a job offer, or just before it, like we do in like in Dubai and UAE, they have to pass the exam first, then they have to apply for the job.
Before it was like this that you were having job offer and then people they were proceeding. But currently the status is you can proceed without job offer. You can go to their system, you can register with the Mamaris Plus. You make your account, you upload your documents, and then they give you eligibility that you can be classified as a specialist or consultant or something like this. And then you can schedule your date for exam.
So, sir, what if we don't get any job in Saudi Arabia, but if we pass the exam, so will that exam will I think that will be of no use. So, is it
Yeah,
possible? Yes, sir.
you're right. You're right.
So, what if?
You're right that
Yes, sir, please.
yes, you're right. Yes, you're right in the way that, for example, somebody has passed the exam and you don't have job opportunity. So this is like a bit difficult scenario. But another situation is that, for example, some delegation is coming to Pakistan and hiring you. Okay, Ministry of Health is basically the body who is arranging or providing health services. But the most important part of Ministry of Health is regulating the health system also. If you are coming to Ministry of Health hospital, they don't ask you to pass the exam there. You can come here in Saudi Arabia, you join your hospital, then you submit your papers to Saudi Council for exam and you process that one. I have seen many people without the license, they have worked for 1 year in Ministry of Health hospitals because Ministry of Health is a regulating body. They have upper hand. They are the one who are actually checking. For example, I am working in private hospital. For me, I am not allowed to practice without the license because I'm working in private hospital. Ministry of Health team can come anytime, and if I'm working without any license, they can put a big penalty on me. And it happened to our hospital. And also they check. For example, one of our colleague, she is working as consultant, and but the license was for teenage star. Then they checked all the papers and then they put a big penalty on the hospital that why a person with lesser classification is showing here or getting the consultation fee for a consultant. Because the interesting thing is that if you are a consultant, your consultant fee is different. So consultation fee is different. Hospital can charge that amount, like it is more than 300 Saudi riyal, something like this. But if you are specialist, then your consultation fee is limited. It is decided by Ministry of Health. So it can be 150 riyal or maybe maximum 200 riyal. So here there are some technical issues. So regarding coming back to your question, so if you are coming to Ministry of Health, maybe you can come here, join here, and proceed for exam. But private hospital nowadays they are preferring the people who are already having passed the exam and they have classification as consultant, specialist, or something like this.
So, what you recommend? Doing the exam before coming to the Saudi Arabia, or we can just give the exam while being in process of getting in Saudi Arabia?
I think if you are free, you have time. I think there is no harm in proceeding for exam. It's a safe investment. You can say that
So, what's the
it will
cost?
save your time.
What is the cost of your exam?
I think it is not so much expensive. I'm not sure about exactly, but maybe it will be 400 or 500 Saudi Riyal, maybe.
Okay. So, what is the work-life balance in while doing practicing in while practicing in Saudi Arabia? Like how many working hours are there, and do you get some time for your family and enjoying the life for your own self? For example, in Pakistan, being a consultant is from morning to the night job.
Yes. So actually, it depends on your working place. In governmental hospital, there are 5 working days, and the working is usually from 8 or 8:30 up till 4 or 5, almost like this. But and I'm talking about this consultant position. But for specialists, definitely they are working in rotation or something like this, and residents also they are working in rotation. And in government hospitals, usually the working environment is not too tight. Okay, so you have at least 2 days off. You can have time with family, and you can go somewhere for umrah, for traveling outside the city. And now even the entertainment industry is developing a lot. Tourism is developing a lot in Saudi Arabia, and this is the scenario. So as per job perspective and security of the job, I think Ministry of Health jobs are a little bit better in this way. But there are other disadvantages that Ministry of Health usually don't allow you to go for vacation. Like in private, usually we can go anytime. If we have remaining balance of vacation, we can go anytime. Like every 1 month, we have to go for some meeting, something. But in Ministry of Health, usually they don't allow you to travel too much outside outside Kingdom, Saudi Arabia. And otherwise, the job in Ministry of Health is better. But if I talk about working in some private hospital, like in private hospital, like I'm working here in my hospital, we have actually 6 working days. And initially, when I came, I was working both morning and evening. Morning, my clinic was from 8:30 to 12, and evening, my clinic was from 4 to 9. So almost 8.5 hours per day I was working. But if I go back and remember my working days as consultant in Pakistan, so it was still much easier for me to work because there in Pakistan it was very hard working. It's like I was leaving my home in the morning 8:30 and then going back home at 9 o'clock. So in between no rest. So that's another story. So the private is usually they are having split timing. But nowadays in private, we have another scenario. Like in my hospital, we are having a lot of part-time Saudi doctors who are working as professors in some Saudi universities or something like this. So usually they prefer to come in the evening. So in our hospital, we have shifted the regular doctor. Like for example, I'm working as a regular consultant, so they prefer to shift them in the morning session, like from 8:30 to 5. So this is the situation. And I have evening clinics now, like 2 days or 3 days I have evening clinics. And but overall, if I compare with private and government sector, the working environment is much much different. Then you can have time with the family. And the most important aspect is social life. So since you are living here in different nationalities, people with different languages, people with different culture. Even the Saudi Arabia's culture is a little bit different, although it is Islamic, same like ours. But their thinking, their social living, sometimes their food preferences a little bit different. Although everything is halal, but our food preferences and their food preferences are a little bit different. So there is a little bit lack in socialization and social life in Saudi Arabia. But definitely every community, they have their own community gatherings and something like this. And another good thing is in big cities you will see a lot of Pakistani restaurants with same taste from Lahore, Karachi, and all the big cities you can see there. And it is like you can say that there is this general approach that things are getting towards globalization and global village, and you can see that the communication has increased a lot. So sometimes even if you are outside the kingdom here, so you don't feel too much homesickness.
Okay, sir. So, comparing the MOH jobs with the private jobs, sir, what you will suggest here? You have experience of working both of them. So, which jobs are better, private or MOH jobs?
In my consideration is if you get a good job opportunity, means that good salary package with consultant position in some private hospital, it is much better than working in Ministry of Health hospital. And another thing is other government entities. Like if you get a job opportunity in Ministry of Defense hospitals or National Guards hospital, so or some like medical city, like King Fahd Medical City, then that job is much better than the private sector, because that job, if you will work that type of environment, that is also working kind of in multinational environment and with high standards and something like this. That will be a good experience. So number one is in my priority. Number one is working as consultant in some medical city kind of hospital or specialized hospitals. Then second option is some good private center. Then third option is Ministry of Health.
And sir, any good reason for this preferring MOH at the last?
One reason is that in MOH usually they have a lot of restrictions still. You know, when you are working like government hospitals in Pakistan, they can move you from one position to other position sometimes. You have a lot of restrictions to work in that environment, and you don't have get extra benefit of your salary. You don't have any special incentive other than your basic salary. If you are working hard, you are getting the same reward. The other colleague who is not working hard getting the same reward. So sometimes you get a little bit discouraged there, although you get respect from your patients and your other colleagues. But definitely these things. And another thing is regarding the vacation and traveling outside Saudi Arabia, still there is restriction. They don't allow you, they don't give you exit free entry visas or kind of things so frequently, which you can get in some medical cities or some private hospitals.
Okay. So, there are also the incentives like there are some jobs also provide accommodation and even the convents as well. So, which type of jobs, private jobs or Ministry of Health jobs provide this type of incentives?
Every job, every job here in Saudi Arabia, they are like it is like general labor laws. And it is a very funny thing in Pakistan also, when you are working in government sector, you will be having allowances that this is your non-practice allowance, this is your housing allowance, but they are very 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 minimal, like some small piece of peanut. So usually we don't know even they are doesn't they don't worth it. But here in Saudi Arabia, like all following the labor laws, they have to provide you housing. Some people they pay you extra money other than your basic salary, and some people they provide you the accommodation.
Okay. So, sir, concluding today's webinar, any last remarks or suggestion for our young consultants who wanted to pursue their future in Saudi Arabia?
I will definitely wish everybody to grow in their career, and financial aspect is very important aspect of your life. Definitely we should first focus on acquiring more clinical skill and improving our knowledge and all this. but financial aspect is very important aspect, and I wish all them they should improve, or they should excel in their career. And my suggestion is that if somebody has done fresh FCPS, at least 2 years, 3 years, he should work hard and explore all the specialty and have a good experience. After that, he should plan for moving outside Pakistan or starting some private practice. If you will come here in Saudi Arabia, you will inshallah get good opportunity to work. And preferably, if they can come after 5 years, 6 years, and come at the position of consultant, that will be much better position. He will be having more confidence. He will be more knowing his own rights, his own limits, so he can explore more better things.
So thank you for your time, inshallah. With this webinar in the comment section, anybody if have any question, they may ask you, and inshallah we will be able to responding it. So jazakallah khaira for your time, sir, and
Thank you.
we also hope your blessing and future wishes regarding our future as well. And inshallah, maybe one in a life we may meet in Saudi Arabia practicing together.
Inshallah,
Inshallah, let's
inshallah.
see, sir.
Welcome, welcome,
Thank you, sir.
welcome.
Thank you for your time, sir.
Thank you,
Thank
thank you very much.
you. Allah
Shukriya.
Hafiz. Well, sir.